Plantar fasciitis is a chronic degenerative condition of the plantar fascia. The plantar fascia is a band of tissue that runs from the calcaneus across the bottom of the foot all the way out to the toes. This helps maintain the arch of the foot, but can sometimes become painful. Again, patients will most commonly have pain at the heel, at the base of the heel, and this can be a really nagging, chronic condition that takes a long time to recover from. We treat this almost always without surgery. Ways to treat plantar fasciitis include stretching and physical therapy, which is the mainstay of treatment. We occasionally give patients injections into that area, which can help relieve symptoms as the plantar fasciitis resolves. Shoe wear modification, inserts in the shoes, are all things that we can give patients to help alleviate their pain. Rarely, when patients have had plantar fasciitis for a long time and it has not responded to those non-operative treatment options, we do consider things like surgery. There are several options for surgery. Some of those are minimally invasive, and then some of those are open with a small incision that allows us to go in and treat the plantar fasciitis. If you have plantar fasciitis or if you have heel pain of any kind, feel free to give us a call at Kona and I'd be happy to see you anytime.